Good afternoon, Sarah. Today, we'll discuss something very important about health that often goes unnoticed: the early signs of vision loss. Understanding these signs can help us recognize and address potential vision issues before they worsen.
Hi, Dr. Mike. I'm curious about this topic. What are some signs that someone might be experiencing vision problems?
A very common early sign is blurred vision. Blurred vision occurs when you find it difficult to see details clearly, either close up or at a distance. It could be a sign of refractive errors like nearsightedness, farsightedness, astigmatism, or even the early stages of cataracts.
That's interesting. So, when people say things look fuzzy or they can't read signs from a distance, could those be early signs of vision problems?
Exactly, Sarah. Let's say you're in a classroom or trying to read the menu at a cafe, and the text starts to appear fuzzy. This could be a sign that your eyes are struggling to focus, which could indicate a refractive error.
What causes these kinds of vision changes, Dr. Mike?
Well, refractive errors occur when the shape of your eye doesn't bend light correctly, resulting in a blurred image. For instance, in nearsightedness, your eye is a bit longer than normal, or the cornea is too curved, so the light that enters your eye isn't focused correctly.
Are these conditions something that people should get checked immediately, or can they wait to see if it gets worse?
It's wise to consult an eye care professional if you notice any persistent changes in your vision. Early detection and proper management can prevent further deterioration and help maintain good eye health. Regular eye exams are crucial for this.
Got it. That makes a lot of sense. It seems like keeping an eye on how clear we see things can really help catch issues early.
Absolutely, Sarah. It's all about being proactive with our health, especially when it comes to our vision. Moving on to another early sign of vision problems that can be a bit perplexing: frequent changes in your prescription for glasses or contact lenses. This is a red flag that often goes unnoticed.
So, does that mean if someone's prescription keeps changing, there could be a deeper issue with their eyes?
Precisely, Sarah. Regular, minor adjustments in prescription are normal over time, but if you're finding that your vision changes rapidly within a year or less, it could indicate an underlying condition affecting your vision stability.
What kind of conditions are we talking about?
A variety of conditions can cause rapid changes in vision. One common issue is keratoconus, where the cornea progressively thins and begins to bulge into a cone-like shape, distorting vision. Diabetes can also impact vision by causing changes in blood sugar levels, which can temporarily alter the shape of your eye's lens.
That sounds serious. How do people usually realize it? I mean, how often should one actually check their prescription?
It's a good practice to have an eye exam at least once every 2 years, but for those with high-risk conditions like diabetes, or if they notice changes in their vision, annual exams might be necessary. This way, any significant shifts can be detected early.
I can imagine this could be quite challenging to keep up with, especially for someone who might not have obvious symptoms other than their prescription changing.
Absolutely, and that's why awareness is key. For example, a student might start noticing that they're struggling to see the board at school clearly, even with their glasses. This could be a sign to get their eyes checked sooner rather than later.
It really puts into perspective the importance of regular checkups. I guess staying ahead of these changes can make a big difference in how effectively they can be managed.
That's right, Sarah. Catching these issues early can help manage them more effectively, potentially slowing down their progression and allowing for a better quality of life. Another important sign we need to discuss is difficulty with night vision. This is a symptom that many might brush off as nothing serious, but it can be an early indicator of several eye health issues.
What exactly do you mean by difficulty with night vision?
Difficulty with night vision means having increased trouble seeing in low light or dark environments. For example, someone might find it harder to drive at night due to not being able to see road signs or other cars as clearly as they used to.
That sounds quite dangerous, especially for driving. What causes this problem?
It can be caused by several conditions. A common one is the natural aging process of the eye, particularly the development of cataracts, which can make the lens of the eye cloudy. Another possible cause is retinitis pigmentosa, a genetic disorder that affects how the retina responds to light.
How do people usually find out they have a problem with their night vision?
Often people might not notice they have a problem until it becomes quite pronounced. They might start by realizing they're squinting more at night or feeling more anxious about driving or walking in poorly lit areas.
Are there any preventive measures or treatments for this?
Yes, regular eye examinations can catch these conditions early on. For cataracts, surgery can replace the cloudy lens with a clear artificial one. For other conditions like retinitis pigmentosa, while there's no cure, there are ways to manage the symptoms and maintain as much vision as possible.
It's good to know that there are ways to manage these issues. It must be quite a relief for people to understand what's happening and know there are options.
Absolutely, Sarah. Knowledge and early detection are powerful tools. By understanding what's happening with their vision, people can take appropriate steps to maintain their eye health and safety. Let's talk about another intriguing symptom that often goes overlooked: seeing halos around lights. This can be particularly noticeable at night around streetlights or headlights.
Halos around lights? That sounds almost like something from a movie. What causes this to happen?
It does sound quite cinematic, doesn't it? But in reality, seeing halos around lights is often caused by disturbances in the cornea, the clear front surface of the eye. Common causes include cataracts and glaucoma. The halos are essentially the light being scattered by irregularities in the eye's fluid or lens.
How do people typically notice this? Is it something that just appears suddenly?
It can appear gradually or suddenly, depending on the underlying cause. People might start noticing it in situations with high contrast, like driving at night or looking at bright lights against a dark background.
That must be quite distracting. What can be done to address it?
Treatment varies depending on the cause. If it's due to cataracts, surgical removal of the cloudy lens can clear up the halos. For glaucoma, managing the pressure within the eye with medication or surgery can help reduce the visual disturbances.
It's interesting how these symptoms can point to different health issues. It seems like catching them early could really help in managing the conditions more effectively.
Exactly, Sarah. That's why being attentive to such changes in our vision can be so crucial. Early intervention can not only help preserve vision, but can also prevent conditions from worsening. Awareness and timely treatment are key components of maintaining good eye health. Now let's discuss our final point: floaters and flashes in your vision. These are those tiny spots, lines, or flashes of light that you might occasionally see moving across your field of vision.
I've heard people talk about seeing floaters before. Are they usually something to worry about?
Floaters are actually quite common and often harmless. They occur when the vitreous, the gel-like substance inside your eyes, becomes more liquid as you age. The particles you see are tiny pieces of this vitreous or debris that are casting shadows on the retina.
And what about the flashes of light? What causes those?
Flashes can occur when the vitreous gel pulls on the retina. They are seen as brief sparks or lightning streaks, especially in low-light conditions. While floaters and flashes are often benign, a sudden increase in these visual disturbances can be a sign of retinal detachment, which is a serious condition requiring immediate medical attention.
That sounds serious. How can someone tell if it's just normal floaters or something more urgent like a retinal detachment?
That's a great question. Normal floaters are usually few, don't change much, and are often visible for many years. If someone sees a sudden increase in floaters, especially if accompanied by flashes or a shadow or curtain over part of their vision, they should seek medical attention immediately. These could be signs of the retina detaching from the back of the eye, which is a medical emergency.
It's reassuring to know that not all floaters and flashes are signs of something serious, but it's clear that being vigilant about any changes is important.
Absolutely, Sarah. Regular eye exams can help monitor the health of the eye and catch any potentially serious conditions early. It's always better to be safe and get your eyes checked if there's a noticeable increase in floaters or flashes.
Thank you, Dr. Mike, for all this information. It really highlights how important it is to pay attention to these signs and maintain regular checkups.
You're welcome, Sarah. I'm glad you found the discussion enlightening. Remember, taking care of your eyes is a vital part of your overall health. Stay observant and proactive about any changes in your vision.